Your body doesn't lie to you. When something feels off, mood, skin, memory, energy, there's almost always a reason behind it. And for so many women, that reason traces back to one hormone: estrogen. Estrogen isn't just about periods and fertility. It's a guardian hormone. It protects your brain, your heart, your bones, your skin, nearly every system you rely on to feel like you. So when estrogen starts to decline, the fallout can show up in places you'd never expect. Hi, I'm Dr. Barron, and today I want to walk you through 10 signs your body gives you when estrogen drops, and why paying attention to them actually matters. 1. The mood swings you can't explain. One moment you're fine. The next you're irritated, tearful, or ready to snap over something small. This isn't a personality flaw, it's chemistry. Estrogen helps regulate serotonin and dopamine, the very neurotransmitters that keep your mood steady and your stress response in check. Take estrogen out of the equation, and emotions stop behaving. They spike, they crash, they feel bigger than the moment deserves. 2. Exhaustion that sleep doesn't fix. This isn't ordinary tiredness. Women describe it as a bone-deep fatigue, the kind where you're still showing up for your life, your job, your family, but you feel like you're operating on empty. You push through because you have to, but underneath, your body and mind are running on fumes. 3. Skin that suddenly feels like a stranger's. Estrogen fuels collagen production, and collagen is what keeps skin plump, hydrated, and resilient. When estrogen fades, skin can turn dry, itchy, and thin almost overnight, especially around the face, jawline, neck, and eyes, where the skin was always more delicate to begin with. Fine lines deepen, softness gives way to crepiness, and it's not just your face. Your arms and hands thin out too, often becoming irritated or uncomfortably itchy. If you're only moisturizing your face, you're missing half the picture. Your neck and hands deserve the same attention. Suzanne Somers used to describe menopause with her own version of the 7 dwarfs: itchy, cranky, sleepy, sweaty, bloated, forgetful, and achy. We've already touched on itchy skin, cranky moods, and sleep exhaustion. Let's keep going. 4. The belly that won't budge. When estrogen is in balance, your body tends to store fat around the hips and thighs, the classic pear shape, which is actually the healthier pattern, linked to lower risk for heart disease and diabetes. But once estrogen drops, fat storage shifts toward the belly, creating more of an apple shape. That shift matters because belly fat, visceral fat, wraps around your internal organs and raises your risk for heart disease and diabetes. On top of that, your metabolism slows, water retention increases, digestion sluggishly grinds along, and suddenly bloating becomes a daily companion instead of an occasional visitor. 5. Hot flashes and the personal summer. This is the symptom everyone associates with menopause, and for good reason. A wave of heat rises through your chest, neck, and face, sometimes with flushing, sometimes with a full sweat. Some women joke that they're having their own personal summer, while everyone around them reaches for a sweater. At night, these flashes disrupt sleep, leaving you exhausted and short-tempered the next day. The cause lives in your hypothalamus, the brain's internal thermostat. Estrogen normally keeps that thermostat steady. Without it, the hypothalamus overreacts to tiny temperature shifts, triggering intense heat responses even when your actual body temperature has barely moved. 6. Brain fog that makes you question yourself. Estrogen supports dopamine and norepinephrine, the neurotransmitters responsible for focus, memory, and executive function. When estrogen drops, that system starts to falter. Concentration slips. Words disappear mid-sentence. Simple tasks suddenly require more effort than they should. Add in the sleep disruption from night sweats, and your brain is running on a serious deficit. For women who already live with AD, this hits even harder. A survey from Attitude magazine found that 94% of women with existing AD saw their symptoms worsen during perimenopause and menopause, and 70% said the brain fog and memory issues were life-altering. 7. Vaginal dryness, UTIs, and bladder pain. As estrogen declines, the tissue lining the genital and urinary tract thins, loses moisture, and loses the natural acidity that normally wards off infection. That leaves you more vulnerable to dryness, irritation, and recurrent urinary tract infections. Even the bladder itself becomes more reactive. Some women develop interstitial cystitis, a chronic condition marked by pelvic pain, pressure, and an urgent frequent need to urinate. Estrogen normally keeps the bladder lining resilient. Without it, that lining becomes fragile and prone to inflammation. 8. Joints that ache for no clear reason. Estrogen is a natural anti-inflammatory. It keeps inflammatory molecules like TNF-alpha and IL-6 in check, which is part of why your joints normally move without complaint. Once estrogen drops, that protection weakens and inflammation creeps in, often felt first in the knees, hands, and other small joints as stiffness, aching, or swelling. 9. Bones losing strength you can't see. This one is silent but serious. Estrogen keeps a careful balance between breaking down old bone and building new bone. When estrogen falls, that balance tips, and bone density can decline by 1 to 2% every year in the years right after menopause. You won't feel this happening day to day, but over time, it significantly raises your risk of fractures. 10. Broken heart syndrome. Here's one most people have never heard of. Estrogen helps your heart handle stress. Without enough of it, your heart becomes hypersensitive to stress hormones like adrenaline, and in rare cases, this can trigger a sudden, temporary weakening of the heart muscle called Takotsubo cardiomyopathy, literally translated as octopus trap, named for the shape the heart takes on during the episode. It's known as broken heart syndrome because it's often triggered by intense emotional stress, and it can mimic a heart attack, with chest pain and shortness of breath. The reassuring part, it's usually temporary and reversible, but it's a powerful reminder of just how deeply estrogen protects your heart. A word of caution before you diagnose yourself. Here's something important I want you to walk away with. Not every symptom during perimenopause or menopause is automatically about estrogen. If we assume it always is, we risk missing something else entirely. Take anxiety and heart palpitations, for example. Yes, they're common in menopause, but we're also seeing a rise in dysautonomia connected to long COVID, where the autonomic nervous system becomes dysregulated, causing sudden heart rate spikes and a feeling of anxiety that has nothing to do with hormones at all. Or consider women on thyroid medication. Estrogen increases a protein called thyroxine-binding globulin, which binds up some of your thyroid hormone in the blood. When estrogen drops, that protein drops too, which means more thyroid hormone is left unbound and active in your system. Your TSH might look borderline, even normal, but you could still feel jittery, wired, or overstimulated, simply because your body has become more sensitive to a medication dose that used to feel fine. Often, just lowering that dose brings real relief. The takeaway? Your body is speaking to you constantly. Estrogen explains a lot, but not everything. The real goal isn't to slap a label on every symptom. It's to actually understand what's happening inside you, so you and your doctor can get it right. If this helped you make sense of what you've been feeling, give it a like and subscribe so you don't miss what's coming next. And please remember, this video is for education, not a replacement for medical advice. Always bring what you're experiencing to your own healthcare provider. I'll see you in the next one.